And so Dana, again, there is some precedent for this, but as you were alluding to before, a lot of it was still more horizontal. So we had the wave of specialty pharmacies merging with PBMs, kind of very much related. It's the distribution side, of the management side. And then we started to see, again, even within hospitals, but the way that started to happen and kind of had a pause was this diversification that Mike is alluding to, where we saw Highmark start to become also a provider, and we saw UPMC become a payer, and Geisinger became everything to everyone. And why did it always happen in Pennsylvania? But we also had United Healthcare and Optum. And there's all this talk about what's happening now with the mergers we'll get into specifically. But again, we had this prelude, but it paused. It looked like it was going to be a wave, but it wasn't a wave. So I'm curious what you think, why did it happen, but why was that not the wave and now it's happening?
Well, I think the big drivers right now, we all know that healthcare costs are not sustainable. That's obviously one to put out there. But I think the big driver now, in terms of why it's happening more, is we have the capability, we have the data to really drive that is driving these mergers and acquisitions. To Mike's point earlier, is it more about saving cost, or is it more about, are we moving towards more population health? How can you actually save cost in the system? And how do you get there? And a lot of it is through data. So there is more opportunity for efficiency and really driving down their cost, either from a payer perspective or a health system perspective, but there's just a lot more opportunity to do that where that wasn't really available 10 years ago, 15 years ago.
So anybody want to be more cynical and say that it really isn't about lowering costs for the companies that have been involved in this process? So Mike was really about growing your market share through diversification of services, a little different than really having this more noble, intent of lowering cost of healthcare.
Well, and the one other thing I would add is lowering cost of healthcare while making it a better service for the patient. But then the other thing too is to make it more patient-oriented, and I think that's a really big, the second really big driver right now. And that's where I was going with the data, is that it is a lot of these mergers and acquisitions are really focused on the consumer and making it about consumer. A better experience for the consumer. If you think about the Amazons and even the Walmarts of the world, those are somewhat stunning in terms of what they bring to the table.
But you shouldn't forget for a second that those are not independent. So it's always a good thing to grow your membership. The more beneficiaries you are, the better off you can be. You want the right kind of beneficiaries, right? You don't want the ones that have 18 comorbidities that are going to cost you $1 million. But growing your membership is always a good strategy. Enhancing the patient experience allows you to grow your membership. Controlling costs allows you to lower or at least reduce the rate of rise of your premium, becoming more attractive to your self-insured plan sponsors. Home Depot would very, very much like to spend not as much money next year on healthcare. So they're interrelated. I think the ability to execute on a consumer-friendly model, the ability to control costs, is dependent on harnessing the information that is there within your data, right? So they're interrelated. This is all interrelated. Now, in terms of limiting horizontal integration, I have 3 words for you. Department of Justice. So they just did not look very kindly on the idea that Aetna was going to purchase Humana. They didn't look kindly on the Anthem Cigna deal. There were clear concerns regarding limiting choice within specific markets, right? So there were markets where there was a lot of overlap. They were going to wind up representing 60-70% of the commercially insured population. DOJ was not into that because they were, I think, legitimately concerned that it would impact the consumer choice, consumer experience, consumer costs, because of course when you have a monopoly you can do what you do when you're a big business, right?
All right, so let's focus now on these most recent mergers. And we again enumerate them: CVS and Aetna, Cigna and Express Scripts, Walmart and Humana, Amazon and PillPack. And I want to do something that hopefully will be fun. but it takes me back to watching the McLaughlin Report. And I want to do I want to get, all right, for those who aren't familiar, right? One of the early political talk shows in which he would do rapid fire as the host to the guest. You know, yes or no. I won't pin you down that much.
Do I get to be Buckley?
You can be Buckley.
Oh, good, cool.
We trade off. He wants to be Will Rogers. He wants to be folksy, but he's so smart he can't help himself. All right. So what I wanted to do is kind of this more rapid fire, not one-word answers necessarily, but I want to run through some comments kind of that have been out there in the media coverage of this. And so the first one would be, which of these proposed mergers do you consider to be the most logical, and which of these are the most surprising? Somebody take one.
Amazon and PillPack, logical and quite frankly, brilliant.
Right, because you need pharmacy licenses in 50 states. It's really nothing about PillPack. It's all about how to get 50 licenses quickly. Agreed?
Yes, agreed.
All right.
Totally had that one.
All right.
I took the easy one.
Well, I would say the surprising one to me was Walmart Humana. Walmart moving into, they have a very consumer-friendly business, and moving into healthcare was a bit surprising to me.
Not to you?
Not completely. As somebody said to me once, there are many places in America where the closest Walmart is a heck of a lot closer than your doctor's office. And the idea of bringing care to the consumer in a consumer-friendly environment, I think, is a really interesting thought.
So the CVS Minute Clinic moves into Walmart now.
Yeah,
And they're already in pharmacy. They already do
pharmacy.
prescription pharmacy.
I didn't say it wasn't logical. I just said that
Surprising.
yes,
Right.
I just said it was surprising.